So both asthma and COPD, or chronic obstructive pulmonary disease, are both groups of lung diseases that make breathing difficult. Specifically, both of these conditions block airflow into the lungs and out of the lungs, and often patients have difficulty getting air out of their lungs. Unfortunately for both, they're chronic conditions, they're lifelong, but with medication and with the help of a doctor, the symptoms can be managed. So many of the symptoms are similar between the two conditions. For COPD, patients often will experience symptoms more on a daily basis, where asthma, these symptoms can come and go. But many of these symptoms include wheezing, coughing, shortness of breath, maybe shortness of breath with going upstairs or with physical activity. For many patients also, coughing up a lot of mucus or phlegm is also a big component of their asthma or their COPD. And complications include, again, flare-ups of their disease that often result in unplanned visits to their primary care physician, to urgent care, to the emergency department, and some patients maybe even have to be hospitalized for flare-ups of these conditions that require even more intensive treatment. So standard treatment for both asthma and COPD typically involves inhalers. These inhalers can relax the muscles around the airways in the lungs to make it easier to breathe better. Some of these inhalers also are inhaled steroids that control inflammation in the lungs. These medicines are designed to help improve symptoms, so you're not having as hard time breathing on a daily basis, but also helps prevent exacerbations or flare-ups of their diseases. Patients don't have to go to the emergency room or go to the hospital for more intensive care. So in people with severe symptoms who are not controlled on inhalers alone, there are newer medications out on the market called Biologics. These medicines are injected under the skin, and depending on the type of asthma or COPD that a patient may have, they can benefit from these type of medications. Usually these medications are prescribed with the help of a specialist who co-manages one's asthma or COPD with their primary care physician. So the winter months are pretty crucial actually for both of these lung diseases. Specifically, patients with asthma, patients with COPD are at risk of flare-ups in the winter that could be due to a variety of viruses that are circulating. This also includes the flu. So for these patients, it's really important for them to have their flu shot every single year. Either as a secondary complication of the flu or just a flare-up, they're also at risk of pneumonia, specifically bacterial pneumonia. So there's also another vaccine that patients with asthma and COPD should be up to date with, and that's the Pneumonia Vaccine. So in the winter months, when patients with asthma or COPD are at higher risk for flare-ups, their doctors might increase some of the dosages of their inhalers, whether it's the steroid or another medication, to help ensure that they're protected against these flare-ups.